In one of the world's most populated areas, an outbreak of the coronavirus could pose enormous challenges. Social distancing is nearly impossible for Palestinians in the besieged Gaza Strip. 2 quarantine centers are being built in the south and northern areas that could house 1,000 people in a worst-case scenario. All those returning from abroad have been put in isolation, and Hamas authorities have turned hotels into quarantine centers. 13 years of the Israeli-Egyptian blockade and 3 wars with Israel, officials say the health system here is in shambles. They warn the region will not be able to survive an outbreak.
Even without a pandemic, the Ministry of Health was already unable to provide people with all the services due to the siege. It would be catastrophic if this spreads. We started transferring some of the medical equipment from hospitals inside Gaza to the new hospitals dealing with patients.
The new field hospital in Rafah has fewer than 40 beds and 6 intensive care units. Another hospital is being set up to treat more patients if needed. In all of Gaza, there are only 70 intensive care beds, and the hospitals lack masks and disinfectants. The World Health Organization has sent some medical supplies, including hundreds of testing kits, but it's not enough to meet demand.
People are vulnerable here in Gaza, and they don't know what to do, actually. So Gaza needs everything. In medical supplies, we need a lot. We need more technological, instruments, so we can to detect people who really has this virus.
Restaurants, schools, markets, and mosques have been told to close to help prevent gatherings among Gaza's 2 million residents. Many say they recently started sensing the danger. They are now stocking up on supplies in case of a lockdown.
The state of emergency and fear started after we learned about the first 2 cases. People weren't taking the issue seriously in the beginning, but now they were forced to.
We are witnessing an unusual movement. People here are used to crises. When they first heard the news, they got paranoid and scared of everything. It's only natural that they are scared.
Although Israel fully controls Gaza by land, air, and sea, it has disengaged itself from any responsibility related to the enclave. Many human rights activists say Israel is the occupying power and should lift its blockade and help people here if there's a large outbreak. Nida Ibrahim, Aljazeera.
At Queentex, this is anything but business as usual. The company, which provides clothing and blankets to Gaza's health sector, had largely switched from manufacturing to importing what it could get through the Israeli and Egyptian blockade. But now it's rehiring laid-off employees to make just one product: medical-grade coveralls for health workers preparing to confront the coronavirus.
Now we're getting an income. We can buy food for our children and get them what they need. Before the coronavirus, we could just get a bit of seasonal work.
Co-owner Hassan Alwan is, for now at least, rare in Gaza, someone who's seen the effects of the pandemic up close. He'd been living in China for 15 years, sourcing the company's products. When the virus started to spread, he was quarantined there for 2 weeks before deciding to come home.
I knew the virus would reach us here. I wanted to import the suit from China, but it would have taken too long. So I got all the specifications from Chinese friends and decided to produce it here. We found the raw materials and made a prototype, and I got the Ministry of Health's approval.
He says his 5 factories can produce 1,000 suits a day, but Gaza's market has only enough raw material to make a total of 10,000. The same blockade that has hampered the market has also slowed the entry of the virus into Gaza. But with a handful of cases now detected, there is huge concern about the potential impact on a densely packed strip of 2 million people reliant on an already struggling health system. Another textile factory and more intense activity. Here and in 4 other restarted sister factories, they're working 2 shifts a day to meet demand. But these masks aren't for Gaza, they're going to the occupied West Bank and to Israel.
In the past,
Gaza factories had been working around the clock to supply Israeli, West Bank and Gaza markets. But because of the Israeli siege, we all stopped our production lines. Since the spread of the coronavirus, I got purchasing orders from an Israeli private company and another company in Hebron in the West Bank, a total of 5 million masks.
Haboob has rehired more than 150 unemployed workers to fulfill the massive orders. But while he and his employees are glad of this sudden surge in demand, there's also a fear that it could be the prelude to a devastating new crisis for Gaza's economy and the health of its people. Harry Fawcett, Al Jazeera.